Well, I actually have many more scenarios similar to those we've just discussed, and I bet you do too as well. But let's turn to a more positive scenario for a change. This is a workflow mostly working. In this case, the patient is a healthcare professional in the Midwest who was diagnosed after 2 years of some subacute health issues by the primary care provider with an acute and severe condition. The patient, knowing how severe the condition was, sought a clinical trial only available on the East Coast in a center of excellence for the patient's condition, and was accepted into the trial and able to afford the cost of the family to stay in the area during the 6 weeks of inpatient treatment by a wide range of specialists, with the primary investigator on the clinical trial serving as the lead physician. The patient then returned home to care by her primary care provider, with whom the principal investigator lead physician from the East Coast kept in touch and who continued to serve as lead physician as to her treatment regimen. The patient needed to travel to the West Coast for work. The primary care provider and principal investigator lead physician arranged for the patient to be seen by a cooperating hospital on the West Coast for continued lab work and any necessary treatments. So the questions here: does this example display the norm in healthcare? What factors contributed to workflow mostly working? Why is this case study described as mostly working? What could you anticipate going wrong? Let's think about this. So to some potential answers. Does this example display the norm in healthcare? Well, it's certainly desirable, but sadly it's not really the norm. Although obviously there is variation from site to site. There is much more emphasis, though, on the center of excellence in the clinical trial environment to be above the norm. What factors contributed to workflow mostly working? Well, first of all, the patient knows the way around healthcare, knows to go to a place like this, knows to seek out a clinical trial. The patient often knows that this patient also knows that the Center of Excellence and clinical trial not only does better, but has the time available and the resources to do better because of the additional support that such organizations tend to get. Why is this case study described as mostly working? What could you anticipate going wrong? Well, the primary care provider appeared to delay an accurate diagnosis. It took 2 years of visits and sort of subacute issues to be recognized. The primary care provider also appears not to have sufficient resources to direct the patient to the best care, or may be in a competitive mode, or should have really said, what about a clinical trial for this? The patient will most likely need to continue being the primary contractor for the care to be received in the future.